Hello, my name is Dr. Taral Nagda. I'm a pediatric orthopedic surgeon. I'm head of Department of Children's Orthopedics at SRCC and at Children's Hospital in Bombay. And we run a very special OPD for cerebral palsy at our hospital. Cerebral palsy is a very important problem in world today. It is number one cause of physical disabilities in India and other countries. And this is the place where Dr. Mullah Furoz first started the first cerebral palsy clinic of India way back in 1948. And we are carrying forward that legacy here. We have a comprehensive cerebral palsy clinic where we have a pediatric orthopedic surgeon, we have pediatric neurologist, we have developmental pediatricians, we have occupational and physiotherapists and speech therapists and psychologists and orthotic support. So everything what is required to assess a child with cerebral palsy and treat it in a holistic manner is available at this hospital. So it makes it a very unique center. What is cerebral palsy? Cerebral palsy is caused by an injury to the motor cortex of brain. Our brain has many centers, those which are responsible for memory, for speech, for sensations, for hearing, for vision. And similarly, there is a center which is responsible for movements. When a child, when he is born, gets less oxygen to this center, the motor center gets affected. And these are the children who get delayed in their motor milestones. A child normally sits up at 6 months. This child will not even able to be seated at 9 months or a year. A child normally walks at a year, but these children take a very long time to walk, and some of them may not be able to walk. Now, wherever there is injury to motor cortex of brain, what happens is there are excessive impulses through spinal cord, which causes spasticity in the limb muscles or a lot of tightnesses. And what happens is muscle which is spastic or tight, as the child grows, the bones grow, but these muscles cannot grow, and hence these children develop gradually deformities. So now there are dual problems. One is of spasticity, second is of contracture. And it's very important that if these children have to be able to stand and walk, and they should be able to go to school, we take care of their spasticity and contractures. And how do we do that? When a child has just spasticity, a neurologist would start them on antispastic drugs. Children who have focal spasticity, we give treatments such as botulinum toxin injections in specific muscles. Now, we are a center which is very special because we do ultrasound guided botulinum toxin injection, which makes it 100% foolproof and also requires less dosage. Also reduces the chances of side effects and toxicity. So this is something which is very important. Children who have shortening, we have a very special surgery, for which a lot of patients come to us from all over the world. And this surgery is known as percutaneous myofascial release, or PMFR. What we do in PMFR is with ultrasound guidance, we take a small needle, and with this small needle what we release is covering of the muscle, what is known as aponeurosis. And when this aponeurosis is released, what the muscle lengthens, and child who is able to walk, initially walking with equinus gait or walking on toes, is then will be able to walk on the heels very well. A child like this who is walking with knees bent, you can see that child is walking with knees bent, not able to walk straight because his hamstrings are tight. And when we do PMFR for his hamstring muscles, what really happens is now the child is able to walk with his knees straight. So we have treated a number of children. We have a comprehensive approach, and we are one of the best centers in India to take care of children with cerebral palsy. There are older children who have problems with hips in cerebral palsy. There are children who walk with crouch gait, and these are the children who require bony surgeries. And we do bony surgeries for these children. They are very extensive surgeries, but we have excellent anesthesia support, excellent post-operative care, which makes the surgeries for these children successful. For us, cerebral palsy is not a profession, it's not a clinic, it is our mission. And I want to tell that if your child has cerebral palsy, come to SRCC NH Cerebral Palsy Clinic. We will do our best so that your child can achieve the best what he is capable of. Thank you. This is Dr. Taral Nagda from SRCC NH Cerebral Palsy Clinic. Bombay.